so thirsty. Hurry up, I have to go to the bathroom so badly.
Hi.
Hi.
My, you've lost a lot of weight.
Really? Mom, I'm Googling stuff and it looks like I might have diabetes.
What's that?
It's when the body cannot regulate the amount of sugar or glucose in the blood. It's a disorder of the endocrine system.
Really?
Yeah, and it looks like there's two types. Type 1 occurs when your body does not produce enough insulin, but type 2 means that your body cannot use insulin properly, and the glucose in the blood cannot move into cells, so it ends up staying in the blood. But type 1 cannot be prevented. Type 1 usually requires daily insulin treatment to regulate blood glucose levels, and usually is diagnosed during childhood.
Really?
Yeah, and
Wow.
type 2 is usually developed at an older age during adulthood and is controlled with diet, weight loss, and exercise. And it may require insulin to control blood sugar levels. But a healthy diet and increased physical activity can help for prevention when it comes to type 2.
Well, looks like I better schedule you a doctor's appointment.
All right.
Hello, Miss Andrews. It's nice to meet you. My name is Dr. Russell.
Hello.
How are you?
Pretty good. How are you?
I'm good. So we got the call from your mom that you wanted to schedule an appointment, and we just recently got the results of your A1C test, your glycated hemoglobin test. That is a blood test that indicates your average blood sugar for the past 2 to 3 months. So yours came up abnormal. You have type 1 diabetes. And so what we did is we measured the percentage of blood sugar attached to your hemoglobin, and the higher your blood sugar levels, the more hemoglobin you have with sugar attached to it. And if you have a level of 6.5% or higher on 2 tests, it indicates that you do have diabetes. So we found that since yours was abnormal, your percentage was around 7.1, which is pretty high. And I have some items to give you here. We have a meter, which you will use to check your blood sugar. This is an emergency kit for glucose. And then we have some syringes and Lantus, which will be your best friend insulin. And then I also got you some carbs cards for kids, which will help you keep track of counting carbs, because that's pretty key. And here's the meter, the book for the meter. When you need to, like before you eat, you have to check your blood sugar using the meter that I have given you.
Okay.
So here are some prescriptions for things like Lantus and test strips which you will need in learning how to deal with your newly found disease.
Thank you.
So think of this as an adventure.
Thank you.
And we will see you, I want to say next week as a follow-up, and then in a few months we'll see you again, because I'm sure you'll be doing fine. If you have any questions about the equipment, you can call my office and we'll work on that.
Okay.
Okay. Good luck.
Goodbye.
Well, there's 2 types. She has type 1. But type 2, if it's not treated, or type 1, I suppose, hypoglycemia can occur where blood sugar levels are really high, and they can cause damage in the retina of the eye, the kidneys, nerve, and blood vessels. Also with type 2, there's a little bit different test that you take. There's a fasting plasma glucose test, also known as the FPG. You can't eat for 8 hours and your blood is drawn, and if the results are greater than 126 milligrams per deciliter, that means that you have type 2.
Because insulin's a hormone, it binds with glucose and needs to be transported all around the body to make the glucose work. Blood sugar levels should stay between 70 and 120 milligrams per deciliter, and higher levels mean that insulin is needed, but lower levels mean food and especially carbs are needed. Symptoms for type 2 include sores, cuts, yeast infections, and tingling of the hands and feet. Obesity goes hand in hand with type 2 diabetes.
So, back for a week, after a week since your diagnosis, how's everything?
Good, I've gone over the carb cards with my mom, and now I know all about Lantus, how I need it in the morning to make sure my blood sugar levels are stable during the day, and I know I have to replace it every month, and I use my insulin syringes with this once a day in the morning. And I know all about the Humalog with the shot I need before I eat, and whenever I don't feel well, I need to take my blood sugar. And if my blood sugar ever gets too low, I know that I always need to have glucagon with me just in case of emergencies. Thanks for all the help with the equipment.
Yeah, I'm glad you get everything worked out. I'll see you in 6 months.